Hi, in this video, I'm going to be talking about an underlying condition associated with vertigo-like symptoms that you might not be familiar with. Before I go into that, let's talk about how you can connect with us. If you're local, call us at 618-288-1489. If you're not local, that's okay. Go to our website at visionforlifeworks.com. You can do several things there. You can read all kinds of success stories. You can read about what we do at our clinic. You can also schedule a consultation. Now, let's talk about this. What's this thing that might be associated with vertigo-like symptoms, dizziness, disorientation, nausea, a feeling of motion or sensing motion? And it might be worse when you're in motion, or in some weird cases, it might be better when you're in motion. But what condition is associated with that stuff that no one really thinks about? Because most of our patients come to us having gone through OT and PT or having had a procedure called the Epley procedure, and they're still like, I still have some symptoms. Now, in cases of true vertigo, those things, OT, PT, and the Epley procedure, probably will resolve that and away you go. But if there's this underlying visual condition, then it won't go away. Even with that treatment, you'll still have a problem. And what it is a vertical misalignment of the eye. It can be called sometimes hyperphoria, vertical heterophoria, or a hypertropia. But basically what it means is that one eye isn't lining up in alignment with the other eye and is going out of alignment vertically. This could be like a person looking off to one side and the eyes misaligned. It might be in straight ahead, like central gaze. And it could happen whenever you're trying to look over your shoulder and driving. Ooh, that one is the worst because it causes people to have double vision up and down and sometimes even diagonal. Oh, that one isn't fun at all for people. But this can cause a lot of difficulty and kind of feelings of disorientation, also some dizziness. And just in general, it really puts people down in terms of if they just all of a sudden have it develop and their whole world seems to be kind of thrown into a tailspin, so to speak. And they do feel like, gosh, this is vertigo. What the heck is going on? And it's really disheartening for patients to go through all kinds of physical therapy or occupational therapy or Epley procedures, all the stuff. And then they still feel like, wow, what? They still have this issue. So those types of treatment won't necessarily correct if a person has this vertical misalignment. What does, you might ask? Well, that's something that we do in our clinic. There's several things that can be done associated with correcting that. And it is correctable, by the way, which some doctors will tell you you can't. But that's not true. So we, as you know, use something called syntonics, light therapy. I call it neurological light stimulating filters. Okay, so what they are in this specific one that works on this vertical problem, it's kind of like this blue color. If you can see that, hopefully you can. But it works on aligning the muscles up and down so that the eyes can learn how to line what we call like against the horizon line. So if someone is having a vertical misalignment of the eyes, the muscles that control that misalignment so that they can become in alignment with one another basically need to be triggered in the appropriate way. We do that with neurological stimulating filters, but at the same time, you also need to have vision therapy, which is more hands-on, and it's an approach of kind of the weightlifting, so to speak, where we're teaching you how to align the eyes so that you can control this misalignment. So that when you're driving and you need to look over your shoulder, you don't want to have the tendency of kind of closing an eye in order to adjust or adapt for that misalignment. But if you learn how through using filters and therapy to control the movement of the eyes up and down, you won't have to do that. And that's what we do at our clinic. It's actually one of the things that we work on a lot in our clinic. So if you're interested in finding out more about how we can correct that, because maybe you've kind of felt like, do you have vertigo? I don't know. Not really, because you did all the things and it still didn't help and you still have the problems. So what on earth do you really truly have? Well, you really need to be tested for this vertical misalignment of the eyes. If you're local, you can call us at 618-288-1489. If you're not local, that's okay. Go to our website at visionforlifeworks.com. Again, you can do lots of stuff there. There's all kinds of success stories that are just awesome to read, will make you feel good, will just increase your joy and be thankful for all your blessings. But if it's time to take the next step, then do that. Schedule a consultation with us if you're not local. And as always, thank you for watching this video. Hit the like and subscribe button if you haven't done that already. And make sure you pass it on to someone else in case they can benefit from it too. Thank you.